Cancer risk from radiation. Radiation occurs when energy is emitted by a source, then travels through a medium, such as air, until it is absorbed by matter. Radiation can be described as being one of two basic types, non-ionizing and ionizing. 1. Ionizing radiation, IR. IR is defined as radiation that has sufficient energy to ionize molecules by displacing electrons from atoms. IR can be electromagnetic, such as X-rays and gamma rays, or can consist of particles, such as electrons, protons, neutrons, or alpha particles. Natural sources of IR make up about 80% of human exposure, and medical sources make up about 20%. The increased medical use of diagnostic X-rays and computed tomography scanning procedures likely translates into higher incidences of cancer. UV light, UV. Light have challenged the genetic integrity of all living organisms throughout time by inducing DNA damage and subsequent mutations. Despite the many sophisticated mechanisms to safeguard the human genome from the mutagenic actions of DNA-damaging agents, not all exposed cells successfully restore the integrity of their DNA, and some cells may subsequently progress into malignant cancer cells. UV light is categorized into UVA, 320 to 400 nanometers, UVB, 290 to 320 nanometers, and UVC, 240 to 290 nanometers, radiation. Most of the UVC light emitted from the sun is absorbed by the ozone layer in the atmosphere. Thus, living organisms are mostly exposed to UVA and UVB irradiation. The incidence of sun-induced skin cancer, especially melanoma, is on the increase due to higher rates of sun exposure in the general population. The link between UV light exposure and skin cancer is very strong. 2. Non-ionizing radiation. Non-ionizing radiation refers to any type of electromagnetic radiation that does not carry enough energy per quantum, photon energy, to ionize atoms or molecules. An electromagnetic field, EMF, is a physical field produced by electrically charged objects that can affect other charged objects in the field. Typical sources of EMFs are electric power lines, electrical devices, and magnetic resonance imaging, MRI. A low-frequency EMF does not transmit energy high enough to break chemical bonds, therefore, it is not thought to directly damage DNA or proteins in cells. Visible light, infrared, microwave, and low-frequency radiofrequency are all examples of non-ionizing radiation. Radiofrequency in microwave radiation. Radiofrequency radiation, RFR, is electromagnetic radiation in the frequency range 3 kHz to 300 MHz, whereas microwave radiation, MR, is in the frequency range between 300 MHz to 300 GHz. RFR and MR do not have sufficient energy to cause ionizations in target tissues, but are converted into heat as the radiation energy is absorbed. Sources of radiofrequency and microwave radiation include mobile phones, radio transmitters of wireless communication, radars, medical devices, and kitchen appliances. Because the population's exposure to RFR and MR has dramatically increased in recent years, it is of great importance to assess the potential cancer risks of these types of radiation, so that appropriate exposure limits can be implemented. Potential cancer risks from mobile phone usage. A number of studies have focused on the potential cancer risks from mobile phone usage, and some of these studies indicate that long-term mobile phone usage may be associated with increased risks of developing brain tumors. Mobile phones emit RFR and generate EMFs. The current epidemiologic data are largely inconclusive on the association between mobile phone usage and brain tumor incidence, but it is important to point out that, generally, it takes 30 to 40 years for brain tumors to develop, and because mobile phones have only been in general use for about 20 years, there has not been sufficient time to fully evaluate the brain cancer risks of mobile phone usage. Thank you for watching.